just makes me think I have to do something. And we wanted to see this in the workshops this afternoon, increase awareness about local initiatives and practices that we can all be adopting, collaborating on to work forward. Finally, I think both the cooperative and GHHI want us to know that we are here as resources for you all. And so we're eager to collaborate and to move this work forward. And finally, I mentioned the 2018 lead poisoning prevention plan. We're going to be updating that plan based on all the progress that's been made over the last 5 years for the future, and want to start, for lack of a better word, picking folks' brains about that. So we'll have some questions at lunch that we're going to pose, and we're going to use a nifty little online tool to sort of seek some input on that. So that's basically our objectives for the day. In terms of the agenda itself, we are really excited to have Ruth Ann provide our keynote address. She's our president and CEO of the Green and Healthy Homes Initiative, and she'll be speaking shortly. We are also extremely excited to have all three commissioners from DCA, DEP, and the Department of Health join us this morning for a facilitated panel discussion around the lead poisoning prevention agenda in the state of New Jersey. And we'll be doing that following Ruth Ann's keynote. After that, we'll take a quick break, and we are also extremely excited to have Joe Miller join us from HUD, who will be able to talk about amongst other things, all of the grant opportunities that have been announced earlier this week coming out of her office at the Office of Healthy Housing and Lead Hazard Control at HUD. We have Elaine Barr from DEP, as we want to grow understanding about the intersection between climate issues and healthy housing. She's going to join us and talk about some of the state climate goals, and then I'm going to briefly present an initiative that we're very excited about in Trenton, where we're trying to combine and address climate, greenhouse gas reduction, and healthy housing together, in the hopes that we'll get some wheels turning and folks around the state can think about how they might advance similar types of initiatives over the coming years. Following that, we'll break into lunch, and then we've got a series of 2 one-hour blocks of workshops in the afternoon. Those are all listed in your agenda, and we encourage you to attend those and participate in the workshops. So I won't go through all 6 of them, but basically we're looking to build, again, collaboration-based discussion around partnership and adoption of best practices as we move forward. So we're excited to see everyone in the room. I'm tempted to start introducing the Trenton crew to some of our folks here sitting in front of me, but I'll do that at lunch. It's really wonderful to see everybody. So with that, just a couple of logistical issues. We have, this is the main meeting room. We'll be serving lunch here in the cafeteria. You'll be able to just walk in, grab your lunch, come back out. I'll let you get through about half your 1-hour lunch before I start pestering you to fill out an online survey on your phones. We've got a QR code you scan to do that as we collect some data from you. So that'll take place here. There's one breakout room here. I believe that's NavSync 2. We've got another one down the hall, and then the Monmouth Battleground meeting room is down on the 1st floor. So you have to go downstairs to get to that one, depending on which workshops you're looking for. So that's essentially the setup for the meeting rooms. Bathrooms are down the hall to the left, past the library, if you're looking for those. And if you need to get internet access, which you'll need on your phones, although you can use your mobile service too for this, it's very low bandwidth, to fill out the surveys at lunch. But if you need internet access, there are instructions on the back of your agenda to do that. Did I forget anything on the logistics front? All right. Perfect. So with that, all right, 29. Okay, with that, I think we're going to skip the exercise.
Thank you, Jennifer, and we're very excited to hear all of the folks joining us today for this fantastic conversation. I know we'll have even a stronger framework for the work ahead. So now, this morning, it was my pleasure to introduce to you Ruth Ann Norton, the President and CEO of Green and Healthy Homes Initiative. To give a little bit of background on Ruth Ann, She joined the Green and Healthy Homes Organization in 1993 and has led its development to one of the nation's most effective and foremost authority on healthy housing and its impact on the social determinants of health. As an expert on lead poisoning prevention, healthy housing, and the intersection of climate, energy, and health, Ruth directs GHHI's national strategy, policy framework, and services to integrate climate, healthcare, and healthy housing as a platform for improved health, economic, educational, and social outcomes in historically disinvested communities. Ruth Ann serves as a member of the EPA's Children's Health Protection Advisory Committee, the National Leadership Academy for the Public's Health, the National Council of State Housing Agencies, National Advisory Group, the APHA Environmental Leadership Network, and the Johns Hopkins Bloomberg School of Public Health Center for Population Health Information Technology Advisory Board, among others. She is a Rockwood Johnson Foundation Community Health Leader, a Weinberg Foundation Fellow, a We Act Environmental and Social Justice Awardee, and she received the Tony Woods Award for Excellence in the Building for, I know it's a lot, but these are really very impressive. I was very excited to be able to all of that to say. Ruth Ann is going to lead a wonderful talk, really centering us on our day's work and where New Jersey goes within the nation's conversation. Ruth Ann.
Whoever wrote that's getting fired. All right. Good morning. How are you? You know, I just left Philadelphia to come over, and I was thinking as we drive over, 200 and some years ago, Ben Franklin warned us about lead. From his printing press and people getting sick from lead and ink, saying we should never use this terrible, nasty stuff in the United States. And yet we're here today with the Journal of American Medicine. I don't know if anybody saw the article that came out late last year. 5.5 million cardiac deaths that have their grounding in lead. 765 million lost IQ points in 2019. We are here today. I want to say, I want a lot of people to thank, but to hear why I'm excited to be here today is I think New Jersey is the epicenter of what can happen in this country over the next 5 years, with a governor who has put in so much money that no governor in history has come close to what your governor has done in terms of the resources provided on lead. You have amazing groups throughout the state working on aspects of lead in water, in soil, in home visiting, in screening, and prevention that make this really, really an important time. So before I get started, I do want to do a couple of things, which is, first of all, to thank the New Jersey Department of Health for its sponsorship and support of our partners at the Perinatal Partnership, of the Green and Healthy Homes Initiative, of all of the groups that are working on this. And so I want to thank the state for that. And I want to thank our partners at the Southern Perinatal Partnership. And let me say, the trauma that you described about your child, the trauma is enough to make us want to get in formation and bring a revolution of change. For the kids who do have long-term impacts, we have a better moral compass that we must follow. We cannot talk about equity in this country. We cannot talk about the justice and environmental justice until we address this. And I will get to your wonderful slides that Catherine helped me do. I promise, Catherine. But the other thing I was looking at this morning is I know many of you may do this too, but I have a Google alert on lead poisoning. And it's filled every day, unfortunately. But one of the things that came up today is a reminder that of the 16 most dangerous chemical toxins that we face in our country and throughout the world, lead is the most damaging and damning on its entirety, ranked number 1. Because of brain damage, because of reproductive health, because of cardiac health, because it is a leader to creating hypertension through kidney damage. All of the things that we see, right, and coupled with disinvestment in communities to get to where we need to be, we have to not have those things filled every morning on our Google alerts, not have our clinics still filled, and not have our classrooms filled with kids who struggle to read, to concentrate. And then we wonder why, right? Let me thank the staff of the Convening Healthy Homes Initiative. If you could stand up if you're in the room, and there are others coming, but Kari and Catherine and Brandon and Hector, please and I know Celicia and Bert and others are around it. Can you thank my staff for the wonderful job that they do? And I want to make sure that I know we thank the paramedic staff, the Lead Free New Jersey staff, if they're here, but they stand and be thanked too for the great work you're doing. So I'm told these will work. I'm not getting the background DJ music that Bert got earlier. And by the way, you know, Bert cares about the details and he gives us lots of information. And the only bit of information he didn't give you yet is his son just signed with Harvard. So in our lives, we're many things, right? So he's a proud papa. And we're happy for Ian. Even though the University of North Carolina is the Harvard of the South, Northwest Miles, right? My alma mater. Who cares about Princeton? Or Rutgers? Rutgers is great. Princeton is great. You know, you have here too in the state of New Jersey the Robert Wood Johnson Foundation. I am very happy to tell you that this week the head of Healthy Communities, the woman who has led the Robert Wood Johnson Healthy Communities portfolio for the past 15 years, Abby Kosky, has joined the Green and Healthy Homes Initiative. And she brings something very important to us, is a health in all policies outlook. Well, we have a lead in all policies outlook. We'll talk about that a little bit today, because we have to be thinking about all of this together. And so if I don't get to it today, one couple of things I do want to say as we think about lead in all policies and get to these remarks is that we have billions of federal dollars coming. We all know that. We hear about the federal dollars that are coming to communities, and they are really important, and you'll hear about them today. Keep in mind, as we go to more universal screening, as we lower the action level for environmental intervention, right? Prevention is the only cure, but we are about to spend $27 billion throughout the United States, 12 billion of it in disadvantaged and impoverished communities, to move houses to decarbonized, electrified, upgraded homes, which is great. It's great for health, it's great for economic value, it's great for closing the racial disparities on appraisal gaps and wealth. But it is also going to disturb a lot of lead-based paint. And in this country, where we have those billions of dollars, the one thing that didn't get the billions of dollars put behind it is the removal of 84% of the cases in this country, which is coming from paint. So one thing for everybody in New Jersey to know is that this week, the Green Healthy Homes Initiative and Cory Booker have brought back a Legacy Pollution Act that we're going to reintroduce into Congress to right the ship on that to get money coming in on lead paint equivalent and probably larger than lead and water if we're successful, because we have to do that to answer the bell on all of this. So let me tell you a little bit about us that Bert didn't, I guess Bert told you a little bit, but the Green and Healthy Homes Initiative, which was founded as an environmental justice and racial justice organization in 1993, founded itself on the principles set out by 9 parents in Baltimore whose children in 1986 found themselves in the Johns Hopkins Intensive Care Unit. Those families all lived within 1 block of the hospital, yet they had lead levels ranging from 68 to 108. They knew the fate of their children was going to be a struggle ahead. They also knew that coming out of 2 blocks, the 809 block of North Washington Street in Baltimore, that the concentration of lead in our housing was something that they needed to turn their light outward. And so they set out on a mission to break the link between unhealthy housing and unhealthy children. Today, we have advanced that work to look at how do we eliminate lead in housing by thinking holistically about the home, lowering asthma, injury. If you have wet walls and mold, the paint's going to chip. If you have poor windows, the paint's going to chip. Poorly weatherized homes, extreme heat, extreme cold, the house is going to expand and contract. You're going to have toxic leaded dust. So we knew that we had to think more holistically about families, about that work that we have to do for families if we want better outcomes. And better outcomes can't just be that children aren't poisoned. Has to be that kids get in the classroom healthy, ready to learn, to earn, to compete for a lifetime. That also means we have to lower the incidence of asthma. We have to eliminate the possibility of lead, and we have to give stable, comfortable, quality housing so that children can sleep through the night and up the next day and enjoy the quality of life, right? And we also have to take care of the adults and the older adults who can suffer greatly from lead. So today we talk about our work in terms of social determinants of health, opportunity, and racial equity. So, and I really want to thank, truly our staff who lives with that understanding that for everything we do, if families are not better off and demonstrably better off at the end of the day, then we're not doing our job. But most of all, I want to thank each of you because you are doing your jobs. People are better. And we have the opportunity over the next 5 years to get to a greater mountaintop of accomplishment there. So appreciate all that you're looking at. And in that frame of how we think about lead, we think about the 30 million families that every day wake up in unhealthy housing. According to our friends at the U.S. Department of Housing and Urban Development, preventable things. Lead is highly, highly preventable. We know where the problems are. We know what to do. We need the money to do it. We have the skills to do it, and we must do it. Asthma, #1 reason kids miss school. Trip and fall injuries that are preventable. The undermining of energy inefficient homes that need to be brought out of obsolescence to resiliency. If we focus on the 30 million families, and far too many of them here in New Jersey, we will free up $150 billion of avoidable Medicaid costs and be able to do things like use unused administrative dollars out of the Children's Health Insurance Program, use social deterrents of health investments through Medicaid and Medicaid managed care waivers, and we will be able to reinvest in things that are about wellness and about health. This is all doable today. if we align our political will, our personal will, our dollars, and we ramp the workforce to do it. And we are determined to do that because we do think about things in terms of equity, in terms of moving from racial disparities to equity, in terms of moving from health disparities to health. And we have to look at this combination of factors in housing that have such a dramatic impact. And we have to think about housing in the collective of all of those climate dollars that we have today. We should go get every single one of them under the framework of lead, because you can't unlock those dollars unless you take care of the lead in housing, by the way. None of those programs that are going to be out there will actually be able to be done unless we remove the lead from housing, the mold, the mildew, and the safety hazards. Otherwise, they will mandatorily be deferred, declined, and set aside. So there's a lot of incentive to make that successful. It is an opportunity for us to be successful in this work together to unlock that ability to build wealth and opportunity. We've made, lead is one of the greatest public health advancements that we have over the last couple of centuries, yet that map makes me tired. I don't know about you, right? It's like, I look at that and go, I come from a state, we have a 99.6% reduction in childhood lead poisoning. I look at the map and I go, wow, we have a long way to go. Because we can't take measures that band-aid over lead, we have to remove it. We have to really remove the source exposure. And recently, there was an article in the New York Times, if you have a chance to read it, that also talked about all of this legacy of lead. It's not just, it is paint is where we know about 84% of the kids across the country are being poisoned, but soil is pervasive. And the other thing that we are seeing in states, and I don't know if seeing this in the Department of Health, we'll have to talk about it, is the increasing number of children poisoned through spices. Not only, used to always be tagged to the immigrant communities. Happens. Cinnamon was the reason the applesauce, right, was poisoned. It was the cinnamon and the turmeric and the things coming through our country that the FDA has we have to have a mandate, right, to really move in and think about, because that is a very quick absorption. Kids who are ingesting cinnamon, like ingesting lead dust, is going to go directly into their bloodstream, into their kidneys, into their hearts and their brains. And as we know from a journal article a long time ago, but still prevalent, New England Journal of Medicine studied women of my age, 64, and who start having elevated blood lead levels. They'd come into Boston Women's Hospital in Boston, into the emergency room. They'd do their blood work. They had elevated blood lead levels because through osteoporosis, the lead that had been stored there for the generations of their life came anew into their bloodstream. We have to prevent this because it is a lifetime burden. So, older housing stock, right? We know so much about this. 60% of the housing stock in New Jersey. And boy, I gotta tell you, New Jersey is beautiful. When I was driving through it today, I forgot how beautiful it is. But lots of old houses, lots of old cute towns, right? That people don't think about. It's, you know, from the outside, they think about the shore. They don't see the other parts of New Jersey. But what beautiful housing, and the age of the housing stock that is really looking at this map, right? We have 25 cities and towns throughout the state, pre-78, that we have to look at and understand and know. on top of what's coming from smelters, on top of what's in the soil, on top of what may be in the water. So we have to look at all of these things, and it's no surprise, right? In Baltimore, we look at these maps, and the guy named Lawrence Brown from Oregon wrote a book called it The Black Butterfly. But it's the same maps where there are brownfields, and the same maps where there's lead poisoning, the same maps where there's all of those bad things that are happening here. Pottery sites, soil, right, at schools. Just recently, I know in Trenton, the work that had to be done around the Ulysses Grant School. We still name things after Ulysses S. Grant. Sorry. I digress. I was just thinking about his alcohol problem. But all of this, regardless of anyone's political point of view, the facts are the facts. This is environmental racism that is brought by ill-conceived policies and practices, not only in housing code, which also has to be a part of thinking about how we prevent lead, but where did we put the smelters? Where did we put the chemical plants? Where things got placed. Poverty and race drove everything, and we pay for it today. And think about have we made different decisions. But we can make different decisions today, and we must. It's for everyone's good and better piece here. And there is the lead service lines, right? That we are fortunate to have $15 billion in the country, the enormous amount of money that Governor Murphy and the legislature has put in, the amazing water coalitions that have been put together in New Jersey. Some of the work in Newark has set standards for the rest of the country in how to do this right through community action, through collaborative work. In fact, EPA highlighted that work when it launched its Skip the Lead Out campaign earlier this year. And we, have to remember so much of this work is getting the public lead service lines. We have the private lines, and we have the private pipes to have to figure out and deal with, and we have to make sure it's done right. Just like removing lead in housing, if we don't clean up, if we don't use plastic, if we let the dust just fly everywhere, renovations can be the most dangerous thing we do. If we break apart the service lines and only do it partially, you're actually making it worse, right? So we have to make sure training is there. We have to make sure that we think about these things and we do it right. So Hector Moreno, who you'll hear from later, is our building expert, and he's always meticulously thinking about every step. And praise to all the sanitarians and risk assessors and everybody else who does that work about keeping us on how do we do it right? And people in clinics about how you do things right. There's a reason, and we have to do these things in that way. But I think New Jersey is amongst the leaders in the country about taking this forward on lead service line. But it must be coupled with the paint and with the other sources to ensure that our children are there. One of the other things I was interviewed on this year was shooting ranges in New Jersey. Has the highest concentration of shooting ranges with lead residue in the country. All of these shuttered army bases and other places, state National Guard shooting ranges that have been left, and now people are using these facilities for other reasons. And when I was talking to the reporter about this, there were boxes of food, because now it's a food distribution center and food service center for low-income families, sitting right on top of the uncleaned indoor shooting ranges that had never been cleaned for lead. We think, my point in even raising this is the pervasiveness of the problem, right? We have to think about the pervasiveness of this problem, and I hate to say it, the stickiness of lead. That will travel, that will get on people's clothes, it will get on their shoes, it will get on their hands, it will get into food, into water, into the water tables and systems. I am just not a gun person, so I would like to not see these things in general, but the reality is where they exist, they have to be safe on so many levels of thinking about this. And, you know, we deal with in Maine, part of Michigan, and different parts of the country, people getting poisoned by the lead buckshot going into the meat that then people are eating. It's systems, right? But lots of things that happen here. But here's the good news of what we're doing. I think I'm going to do this way a little bit, right? 2,800 kids. Our goal is to get that to 0. Right? That's a lot of children then going into the classroom, going into life. And I don't care how good we think we are, that's not everybody. That's not everybody. And we have, I come from a state that has universal blood testing. I chair the commission there, and we know that we're not capturing all of our kids, right? So we really have to get parents invested, doctors invested, to never miss that test, and to know the test can't be just 1 and 2. It really is where kids are living, what they're exposed to, if they're in childcare, if they're visiting relatives, thinking about this. Lead poisoning doesn't stop at the age of 6. We see people poisoned all the time, right? That are older. So we are making tremendous progress here. We're moving, but we have concentrations where we know. It has to be where we dig in. We are deeply invested, whether it's Patterson in New Jersey or East Orange or Newark. We have to be thinking about going to the toughest places and getting the most done while we think about the entire state. Because rural communities are overlooked a great deal in this effort. But much can be made as we think about how we do this. But we all know that as we move to a 3.5 and we move to environmental intervention at that level, we have to build the workforce, we have to build the public understanding of the urgency. And we have to remember, even at 3.5, that is progress, that is not prevention. It's not prevention. We have to think about 0. We have to think about looking at homes, childcare, and places before we get to that number. And as we pull all of this together, and I was talking about the holistic efforts, we would be remiss if we didn't think about those things that impair kids in the classroom. And lead and asthma are the 2 things to happen. 40% of all emergency room visits and hospitalizations for children, according to the Robert Wood Johnson Commission on Building Healthy America, come because of lousy and unhealthy housing conditions. We can take a big bite out of this number. In more urban, concentrated places, we often find that to be 60, 70, or 80% of the cost. So we are looking at an opportunity to lower that prevalence, to lower the incidence, certainly lower that extraordinarily traumatic experience of an asthma attack for young children, going to the emergency room of the hospital. We will save so much money that we can reinvest in other things. And I really do encourage that we move on trying to get Medicaid managed care and others to help invest in this work more. In our work with WellPoint, also known as AmeriCorps for Anthem, we have seen rates of emergency room visits and hospitalizations go down by 80%, school attendance go up by 92%, and the healthcare system get $1.58 back in savings for every dollar invested. In healthcare terms, it's 32% per patient per month savings. So it's economically good for them, and it is obviously clearly good for kids. But the other thing, we keep having one city up here on every slide. My personal goal is that Trenton doesn't show up on these slides in the next 3 to 5 years. That we deliver on a promise for kids in Trenton and Patterson and Plainfield across the state, but they don't show up on slides. That's not their lives. It's not where they're supposed to be. Some slide that we're talking about, right? We would need to be talking about their brilliance. We need to be talking about they too, whether the kid going to Harvard or University of North Carolina, Chapel Hill, go Tar Heels. But we can do it, right? So we know the evidence is there. We know the business case is there. We know all of those things. We know that we have been at this. How many have been working on lead for more than 5 years? Right? You've been at it and at it and at it. And I hate to tell you, your voices have to get louder. All of those people working 5 and more years and everyone else here, we need 10, 20 more people with us. Because this is the moment when all of this money is going to go in to do good. We cannot let communities who need it most get passed by because of speed. Because the money needs to get spent so we go somewhere else. This is the moment to say, hold us on. Now, here, we have to do this. So we need to take these numbers and turn them around. And we need to see how we could be delivering back savings. I have to tell you something. A few years back, since I raised UNC, our arch rival in life is Duke, right? If you're a Duke basketball fan, please stand, and I'll show you the exit. They did a study on work that we had done around lead in Baltimore. And we had lowered lead poisoning by 99% at the time. And they did this big study and said, oh my God, we've returned 45-point-something billion back to the Maryland. And they invited me to go down and have a speech about this, right? Receive some sort of honor. Didn't want the honor. And the whole point for me was, where did the $45 billion go? Did it go to the people who had been harmed for generations? Did it go to the houses to change the housing stock? Was it being reinvested in historically disinvested communities? Where did it go? So we have to think about, as we make these cases and we put this money in, this is extraordinarily good. Joe Miller will talk about this. These are dollars. States like Michigan get 5 and 6 and 7 of these grants a year, so could New Jersey. Right? Don't just get one for the state, you should get the state money, right? And thank you, DCA, for all the good work. But we should get this in all of those towns that showed up on the charts and beyond. Because all of the savings we create should inure to the children of the next generation, children today. Should be going into the investments in our schools. Should be ensuring that we are drinking clean water, that we are breathing clean air, which includes not having the toxic legacy of lead dust in that, right? So HUD's getting much better. They're being more flexible. They're working to make their monies line up with weatherization dollars, with other housing dollars, thinking about aligning, breaking, and coordinating that. Due in August, we need to get moving on that, right? We have billions in the Inflation Reduction Act, and there's been some applications for the $20 million community change grants. There should be more throughout the state on lead prevention, on making sure we do that. on reducing asthma. There's going to be rebates coming for communities around electrification. Those dollars should be lined up with other dollars around lead. If you do move off of fossil fuels in homes, you are dramatically improving health for asthma, dramatically. Right? 42% reduction in incidence, 24% reduction in cases that we know coming off of gas fueled appliances versus electric. What we're also doing is raising the value of housing, which means intergenerational wealth transfer, closing the 8-to-1 gap between Black and brown communities and white communities on wealth transfer, improving and shrinking that appraisal gap, and moving those things forward. So we have opportunities here. You may be working on lead, but you're in a home visit. You know that we have to do it. And I got out of time. I'm out of time. I have 3 minutes, okay. So happy to talk to you about all of this, but don't think only about lead when you want to solve lead. Think about everything else that touches that environment, that touches that building, right? This is to reduce the 40% of carbon emissions that happen in the universe that come out of homes and buildings, not out of the out of industry. Homes and buildings contribute more than anything else on climate. Think about that, right? It all comes back to homes. Thank you for the American Rescue Plan dollars. Look who's at the top in the investments. That just means we have to do better, we have to perform better, and we have to be the kings and queens of accomplishment on this. Really important, these dollars will run out in 26, and they don't have a chance of being renewed. They don't have a chance. It's not like the grant you can extend. This is Congress said, no, it's done, it's over. And I, right, myself, don't want to give any money back to Congress. Or what could potentially happen in Washington. So we want to make sure that we're spending these dollars, but you're not allowed here, right? And you will hear today a lot about this approach of aligning, creating, coordinating resources, about bringing together lead, asthma, injury, climate dollars. But align, very coordinate is not only about dollars, it's about people. It's about what we can do together. It's about some skill that I may have and you may have another, and that we figure out how we help the neighbor over there because both of us have some pretty cool skills. The single thing that has kept me doing this for 31 years is the ability to ensure that somebody else is better off because I woke up today. And that is the case for every single one of you. I'm an idiot. I wake up happy every day. Then I figure out during the day, like, oh darn, it's not that good, right? But what you have, the power of what you have is enormous. Don't hide it. Don't sleep on it. Not now. The best you will ever feel is when a community's rates of lead poisoning are going down, when kids stop going to the hospital for asthma, and you have made that happen. And you're doing it now. I'm just asking you to do it a little bit more, because we're going to get there. And I have to say, I always feel at home when I don't know where these slides have happened, so I'm going to. There's lots to talk about. There's lots to talk about healthcare investment. There's lots to talk about. I'm out of time. Sorry if I didn't follow all the slides. I'm the worst. I'm the worst person to try to manage in the entire world. But just thank you. I really hope you will thank each other. But let me just say this. You should be grateful for everybody else that's in this room. I'm grateful for all of you. We should also know we have a lot of work. You know, we have an interesting organization. People come, we get some fancy people come and work in our organization and then go oh my God, what you do is hard. What you do is actually real work. Right? And you're tired of doing it. And I think the real greatness is in people who get that work done, who are the unsung heroes, who are the brilliant ones. So thank you for your presence. Thank you.
We're gonna set up for our next plenary, which we're gonna start momentarily with our commissioners, and we're gonna hear about 30 seconds. Thanks all.
Hi, how are you? I'm well, thank you. So nice to see you.
All right.
Jacqueline Suarez.
Yes, good
Very
to see you.
nice
How are
to
you?
do this.
Yep, there you go.
Great plan.
I don't know who's this
That way
is.
we're not.
Do you know whose this is? Huh?
That's right.
Oh. I may have, I think I may have turned it off.
Oh, uh-oh.
It looks great.
Oh, no, it's on.
Yeah, it looks great. Okay,
Yeah.
there you go.
So you got about 50.
Although in the legislature, it's red when it's on.
Yeah, I know those buttons.
I'm already there. Oh. Right.
Okay, I think we're getting started.
Click through on slides, each one of them has a slide.
Yes, we're gonna be, why don't you ask them what they want to do? All right. Part two. This is the good stuff, right? I was just a small warm-up act. This is like the good stuff. The fact that we have three commissioners here to talk with us this morning, I think shows the commitment of this administration greatly to the issues that we are here to care about, right? Lead, healthy homes, asthma reduction. You guys are amazing. I talk about New Jersey to every other state. I brag about you all, so I'm so glad to be here with you. This morning we are joined by Caitlin Baston. Did I say that right? Last name? There you go, right? And Caitlin is the commissioner of the New Jersey Department of Health. And earlier I did give a really good shout out and thank you for the support of so many in this room and the forward thinking around prevention of childhood lead poisoning and asthma reduction and all good things health. Prior to becoming New Jersey's health commissioner, Dr. Caitlin Basson built and led the Cooper Center for Healing, an integrated pain, addiction, and behavioral health center, and was an associate professor of medicine at Cooper Medical School of Rowan University. Dr. Basson began her career as a full spectrum family physician focused on underserved populations. Prior to coming to New Jersey, her work ranged from public health projects in Rwanda to public maternity and trauma hospitals in the Dominican Republic to providing full spectrum family planning services and working in a bilingual community health center in Seattle, Washington, America. Thank you for being here. We are also joined by Sean LaTourette, who is our Commissioner of the Department of Environmental Protection. Good to see you again, Sean. Appointed by Governor Phil Murphy. It says Philip D. Murphy. I don't know what the D is for. There you go. Very good. Sean became the New Jersey Commissioner of Environmental Protection on June 14th, 2021, so happy anniversary, close to it. He served as an acting commissioner since January 16th of 21. Commissioner LaTourette is responsible for formulating statewide environmental policy while directing programs that protect public health and ensure the quality of New Jersey air, land, water, and natural and historic resources. So thank you for being here. And we are also joined by Commissioner Jacqueline Suarez and New Jersey Commissioner of the New Jersey Department of Community Affairs. Jacqueline Suarez was appointed Commissioner of the Department of Community Affairs on May 20, 2024, making her the first Hispanic commissioner to lead DCA. Dr. Suarez is committed to the department's ongoing mission to provide residents, local governments, businesses, and community development organizations with financial support, administrative guidance, and technical assistance to help improve the quality of life for New Jersey families. I did probably just move it out there, by the way.
Actually, I do have an hour.
Okay, so you're good. Okay. Where from?
The honorary
Rutgers, there you go. Okay, good. I didn't screw that up. Thank you. As commissioner of one of the state's largest departments, Dr. Suarez is responsible for a $1.485 billion operational budget and the administration of federal disaster relief grant funding provided through COVID or Community Development Block Grant, COVID, American Rescue Plan, and the Coronavirus Aid and Clean and Economic Security Act. She oversees more than 1,000 employees and leads a variety of departmental programs, including the divisions of local government services, housing and community relations, code standards, and a whole bunch of stuff here that is all about the quality of life in our communities. We are glad to welcome the three of you. I know that love for you all. Tell us a little bit about your work. You may have slides, I understand. Does anybody have slides? Okay, I want to make sure we have the. Okay, you got it. So I know Dr. Dustin come first, or Sean. Clearly, I didn't get the memo, folks.
All right. I think this thing's picking us up, right?
Yeah, it is.
Beyond that, I'm very, so if I need to just project, it's good enough. So first and foremost, the New Jersey Department of Environmental Protection is primarily a public health agency. that we protect our air, land, water, and natural resources because those resources, well, help protect our planet. Right? Clean drinking water ensures that our people and communities thrive, making sure that we're analyzing risks to public health in our air, on our land, and in our water is a critical part of the work that we do. And with respect to identifying where and how individuals, in particular children, can be exposed to lead, we have a number of different initiatives that we work concertedly with our partners here from Community Affairs and the Department of Health to deploy. And one of those that we wanted to share with you all today, to the extent you didn't already know about it, is an important piece of work that Dr. Bastet and her colleagues delivered the funding and helped us to design, along with experts from Dr. Suarez. Dr. Suarez's group, which is our potential lead exposure map tool, right? And so, or PLEM, not PLEM, right? PLEM, P-L-E-M. And so if you were to just Google NJ PLEM, right, you get right to this website. And we're in the first phase of the PLEM site right now, where the primary driving force is the identification of potential lead risk associated with housing stock, particularly with lead-based paints, where we believe those risks would be most present. Right? Because as I'm sure I need to explain to a room like this, prior to, or largely in the 1950s, right, through about the late 70s, we integrated a lot of lead-based paints into our housing. Right? Anybody see those beautiful, beautiful bright blues, right? Back in the 50s, that's lead, y'all. Right? Just had a friend who bought a really old home. She was so excited about this bright, really brilliant color on the exterior of the window trim. And I said, well, I think we're going to have to leave it back. But this tool that we've all worked on to develop for the benefit of the people and communities we all serve is a really critical piece of information. You can hop on this tool, put in any address in the state, right? And thanks to the work that Jacqueline and her team have done, it also includes apartment units as well, right? So not just the single family homes. And so it's a critical first phase of this work, right? Later phases, we want to integrate potential risks from known contaminated sites that have remaining lead risk. I was just yesterday with colleagues talking about remaining lead slag and soils in and around the communities of the Raritan Bay, for example. Right? We want to integrate information like that into this tool, and importantly, information about risks in lead and drinking water, which we'll talk more about as our discussion today unfolds. But a really critical piece of our work. Thank you all very much.
So can I ask you, this is a fabulous tool that so many states are what you're doing. I don't know if you've had a chance to share it with the cities or with the Governors Association, but also I know EPA has their disadvantaged communities, and they're really struggling to get not for creating tools. But this is so good for them to see. So.
Yeah, that's a really great point. I serve as the National Chair of Infrastructure and Land and Materials among all the state environments. And so we're in a constant state of treating information, best practices, and tool development along these lines. So for example, the state of North Carolina has a great dashboard tool analyzing risks of PFAS exposure. And so we're learning from them on that tool, they're learning from us on this tool, and it's a real good back cross pollination. It's really wonderful.
Yeah, this is just amazing. I'm gonna move your, stuff press and we'll come back for discussion, but, at the personal and family level, the Department of Health is in the process of lowering the threshold rate from 5 to 2.5. And can you describe how that, the blood level paradigm and how it may be changing in the new rule, what it means for environmental intervention at that level, and how we're gonna scale?
Yeah, happy to talk about it. Everyone hear me okay? So great to be here as well. And I'm a family doc, as I think that came through at the beginning, that it always makes me sound more impressive on paper, I think, when people read about this. But yeah, I'm a family medicine physician, right? So I've worked in most of my early career, I did global health. And I also did a lot in the United States at a federally qualified health center, that was a bilingual center. Primarily working with a lot of people who were immigrant population or transient or going back and forth. And then a lot of people who were in disadvantaged areas around Seattle and talking to them about, what their health risks were. And constantly as a family doc, right, I'm trying to help people with chronic diseases, acute diseases, whatever they're struggling with that isn't letting them thrive and live the best life they want to live every day. And most of that, the majority of that, has nothing to do with what I prescribe or do. Health has about, you're actually trying to treat medicine, 15% of your health is what we do. Now that may not be true if you're like acutely sick and going to the hospital, right? But on a day-to-day basis, we want to avoid you getting sick. It's all of the things we're talking about here. 85% of the health, of your health, has to do with where you live, how much trauma you've had, what your day-to-day is like. That's 85%. And then I'm here with my little 15%, trying my darndest to help you be healthy, right? So that's why I care so much about population health and public health. And that's why I ended up doing everything I did to try to build healthy spaces and to work with communities. And the way we work to do that is through community empowerment and through advocating for you and anybody that you're serving and everybody in the community to have those needs met. Because that's going to drive so much of your health, right? And when we look at health and life expectancy, you probably know this, but one of the greatest driving factors is your zip code, right? It's actually where you live. 30-year life expectancy difference from your zip code. And yes, there are layers of that, right? There's racism, there's institutional racism, there's years of poverty, there's trauma, there's all of that layers into that. But basically what we're trying to say is your environment, right, and what you're surrounded by every day matters so much more than anything that in some ways feels in your control. And so my job is to empower communities and to work on these things, but also to think about knowledge is power, and information is power. And my job is to get that information into the hands of the people who need it, so that you can make the best decision for yourself and your family. And that's what we talk about with everything from vaccines to lead. And one of the big campaigns we have, because bringing it all back to where we are today, is know your status with lead, right? We want New Jersey to be lead free, and the testing. Anybody know what the testing protocol is? How often are we supposed to? Who are we supposed to test and when? 1 and 2. 1 and 2, right? 12 months, 24 months, right? So this room knows, right? When I ask even the people who work in my health department, they're like, really? Every kid, universal testing, be lead free, test twice before 3. Okay, that's the campaign, that's the slogan, that's what we're telling families. Hopefully it'll stick in their minds, they'll know it. Because believe it or not, and I'm not trying to throw my fellow family docs under the bus here, right? There's a lot to do in an office. And when you go in for your well visit, some offices have things really protocolized and they do pretty well. Others don't, and things slip through the cracks. And it's not because the doctors or the nurses or people don't care. It's because there's a lot that they're trying to do and what we've crunched into like a 15-minute visit, right? Like churn through these visits in 6 to 15 minutes. So we need our communities to know so that they make sure they're asking for it. or even my own chief of staff, who would probably be okay with me telling the story, was like, oh, I didn't even notice that they ordered this for my kiddo because we didn't have a conversation about it. And it was so rote in the office. And then she, once we had this conversation, realized. So all of our kids in New Jersey need to get tested twice before the age of 3. And there's no state led level. So it's not like we're talking about this cutoff change, right, from 5 to 3.5. It's not that 3.5 is like roses. It's just, where do we want to put a lot of effort into intervening? And the goal is to keep all levels 0. And if they're creeping up, to find it as early as possible, so it doesn't get any higher. And lead has a lot of implications beyond childhood development. It also probably has pretty significant implications in pregnancy. And we're seeing a lot of links with preeclampsia, with other things that may be driving disparities in pregnancy outcomes. Again, with that community empowerment, right? So this knowledge getting into the hands of our community. And I hear from people that they're afraid to get tested because what if their landlord evicts them if they go to crack down on this, right? This is what my community tells me. This is what my patients tell me. Like, well, I don't have anywhere else to go. What am I gonna do, right? And so that's why, again, it's all that 85% is that stuff before I even intervene. But it's me trying to say, we've got your back. We will help you. And that's why the 3 of us working together, right? Working on the community, working on the environment, working on housing stock. You want to know, then we really can throw resources at this.
That is amazing. Like earlier, like remarked also on the JAMA article showing 5.5 million cardiac deaths. So it isn't just right that the pregnancy, it's other things long term.
Right.
But this people has to be prevented, but as we were closing, so and then I think we'll have 2 by 3. Which as far as we're looking at the preponderance of problems coming from homes. This entire whole point about where you live and how much. And can you talk about what DCA is doing around testing and assessment? And you have an enormous role on primary prevention, but you hold those resources that ensure other kids that can have a life outside of this not have received that best. So can you talk a little bit about the efforts of the DCA?
Sure, absolutely. So I think we've now seen how this is all segueing and how we're trying to communicate to that point. Is we all have our relative areas of expertise depending on our department. But the Department of Community Affairs often becomes the glue for many of the programs for legislators because it doesn't fit neatly within another department like health or DEP or Adobe, but they then come to us and say, well, there's a community attachment somewhere here, so we're going to stick it in the Department of Community Affairs to figure out how we're going to get that done. So I give our staff a lot of credit on figuring out how it is that we're going to get the money where it needs to go. And one of the things that the administration made really clear is we're trying to be collaborative. So in the wake of COVID, and we've had billions of dollars funding for our city, our goal is to get that program funding out so that people were not really negatively impacted any greater than what they already had. So a lot of us kind of put our heads down, we got to our silos, we were working from home a lot, we were trying to figure that out. Emerging from that, we started having better communication with our institutions about what it was that we were touching upon. How do we work together to kind of build a little bit of a capital stack bill to figure out how it is that we're going to collaborate with our resources to actually have a greater impact on the communities that we're here to serve. So one of the things that we kind of realized was testing is really important, figuring out where it is in the environment is really important. But we at the Department of Community Affairs subscribe to the Housing First model, which is if you don't have a safe, stable place to live, how are all the other facets of your life going to fall into place? Whether that is holding a city job, your kids going to school regularly, you don't have a place to keep your medication safe, how are you going to take it? So all of those things are extremely important, but without a safe, stable house and food in your belly, all of that else kind of falls apart. So
what we kind of said was, well, the legislature said about 3 years ago, everybody has to check how the stuff that was built before that's said. They put that requirement on the municipality, and the municipalities are gonna go out there and have perform these inspections, but they also would allow municipalities to permit a landlord or a homeowner to actually perform that work to bring in somebody who's licensed to perform that inspection, which is great first step, right? And to Mr. Baskin's point, we want to get people tested as well, so we can start figuring out where it is that lead issues are coming from. But then we said to ourselves, okay, well, what are we gonna do once we know that there's lead? Because again, you don't want people to say, well, now my landlord wants me out. Or great, it's unsafe, now where do I go? Because if I want to stay in my community, most of our housing stock is similarly situated, so even if I bounce from A to farm B, I'm most likely gonna have the same situation. Then the brainchild came through, well, how do we remediate the leak? Where do we put those resources that people can actually tap into their housing stock? So we have a slew of different types of programs at the Department of Community Affairs. One of those, the largest one, is our lead remediation and abatement program. And what that actually is funded through a $108 million grant to develop health. That one is the broadest program that we have within our umbrella, because anybody can apply for it, and it's not based on the landlord's income, it's based on the tenant's income. So what the beauty of that is, should there be testing done that shows that there is lead in that property, the landlord or the tenant can actually apply to the Department of Community Affairs to have that apartment actually abated or remediated from its lead hazards. And the beauty of that is there's no kind of barrier to doing that. The money is there, so long as you meet the income threshold, which is based on the tenant, which is typically 80% of the guaranteed income for your time, then we're going to be able to perform that work for you. Now, I will be quite honest with you. We started realizing that, well, we've got an issue, which is we don't have the folks who are trained and licensed to perform this work. So what do we do there? Well, we got creative. What we decided to do was start funding grant opportunities for some of the nonprofit, for-profit entities to train up the workforce to actually perform this work. So that way, we weren't setting anybody up for failure, which is we get the kids tested, the parents realize there's lead levels, most likely from their house, they get the house tested, it comes back very positive, and then all of a sudden it's great, the landlord's agreeing to do it, they apply for our program, but we got really perform the work. So we're trying not to set ourselves up for failure. So in tandem with all of this, we are actually performing the work to train these folks up, and that way we have a pipeline ready to perform the work. I'll be very honest with everybody, the money has been, a lot of them has been covered, about $104.5 million out of that total 180, but only got 15 million people now, which tells us that we need to get the word out because the money is there. And for my account, the money is probably still not sufficient to get all the work done on the state of New Jersey, which tells me that we need to increase the number of applicants that are coming through. So what we were trying to figure out was, and we started having conversations amongst ourselves, how do we start collaborating even better on a state level? So that way, if a child should test positive, how do we automatically get them enrolled into our program? Because we didn't want to have all of these different stops for parents. It's daunting already just when your kid's tested, let alone now that it's a positive test, what do I do? So between the Department of Health and the Department of Community Affairs, we're trying to figure out streamlining that process so that way there's that is the remediation, so that way we can get this test for the property immediately and then get them able to do that. There are also a couple other programs within the state. So we have 2 state programs. One has been legislatively restricted for 5 particular municipalities across the state of New Jersey, like Camden, New York, Trenton, I can find the last one. Smaller pots of money and their safety, but pretty much most of the categories are the same. One for unit dwelling, it's based on the tenant area need to become almost 80%. And the whole point is that we're trying to get in there as quickly as possible. Even our neighborhood one is renovation tax credit program. I don't know if familiar with a lot of folks in the room, but it's one of the biggest success stories I think in a partnership between for-profit entities and nonprofit community-based organizations putting their money where their mouth is and saying, I'm a neighbor and I live in these communities that are going to kind of pay it forward. I think you get 100% tax credit for what they're doing, so I'm good with that out there. But a large campaign to get the information out there about what this looks like through the Department of Community Affairs. And that's part of why we're here today. We want to get this information out to the communities, to organizations, we're having this conversation with the residents so that they know that these resources are available. Because the legislature will make sure that this is important for them, because they money where it's not in. Our department can make it really clear this is a priority for us, this is regulations, the program set up with this funding, but now we.
Sorry? Uh-huh.
New Jersey has the largest investment, American Rescue Plan funds for lead. Talk about priority.
It's 50 things total, and I think 20 have been printed so far.
Will, the opportunity. People are holding permits or childcare or, or whatever brings them to housing. We all need to be really making sure we're building that up. And, you were talking about the workforce ramp up. I don't know if you know, but the Center for Employment Opportunity, big national organization, did a study and showed that the workers who have control and motivation in their portfolio will have a 20% increase market value for their own themselves, right? And so this is a really great opportunity. Really, I think we'll get to add more ways that we as a collective here can get that money spent. It's important, and I appreciate that. Commissioner, we know that lead-based payment is not the source of funding, right? So we're looking at big investment here as well. And soil, where recent report just came out that the basic soil, all of this comes together in the project.
Absolutely. First of all, can you just talk about, there are these two badass women. So sorry. Thank you for that. But look, lead-based paint is not the only risk of lead exposure, but it is the greatest risk. Right? It is the greatest risk that we all have to deal with. And one of the things, even though I am a water policy lead, that often will find myself frustrated is that when we have a concern about drinking, it will tend to carry the day, resound in the public in a way that can distract us from the greatest risks. And that's not to say that lead in drinking water is not a problem and should not be corrected. I'll tell you how to tackle it. But I think that's important to keep in all of our minds, right? That when we see a crisis moment, like in 2018, when we realized that the control of that exposure was compromised, and worked rapidly to address that issue, and to distract families and the government from the greater source of risk. And I think it's important for folks in this room to always keep that in mind. We've made great strides on the risk of lead in drinking water in particular. And we're on our way nationally also. In 2021, we enacted 10-year lead service line replacement requirement. And because the greatest risk of lead in drinking water is from the line that connects not the only risk in drinking water, but the greatest. And there has long been a push to get all of those lines replaced. And now we're on our way toward that. In the next month, we'll report. So I encourage you to go to the DEP website, which we're interested in, toward the end of July. It's in July, all the water systems have to tell us, their most recent report of lead service line. And so if I'm going from last July's information, we've got about 180 or so thousand known lead service lines, with more than 1 million of material of unknown type. Right? And so we've got to solve for that unknown investigation. And then move our from inventory to our replacement, right? We're supposed to be replacing 10% a year, but you're only replacing what you know, right? And so we've got to get folks from this point of our modeling suggests that we've got way more than 180,000. But just the fact of this work being so far along in the state of New Jersey with inventory development has shifted the federal funding formula, that and a lot of these screaming on Capitol Hill, that has brought New Jersey even more federal funding for lead service. Our federal allocation this current year went up by more than 50%, right? And that's because of the work that has been done over years in advocacy from communities like this, right? To push for that kind of approach to lead service line replacement. So kudos to all of you and to Leslie and Jay and all of the partners that have pushed for that. Now, of course, that's still not our only risk, right? We have historic contamination of lead in soils in various parts of the state. There are hot spots in particular that we're dealing with. I'll give you one example. In the city of Trenton recently, just last week, I petitioned the Federal Environmental Protection Agency to list a section of Trenton. I forgot to tell you this. I think I forgot to tell you all that I petitioned the US EPA to list a portion of Trenton as a federal Superfund site. Oh, I did. Thank you. Okay. In order to, and look, some people think, oh, New Jersey has the most Superfund sites in the country because we're dirty and we're poisoned. No, right? We have the most Superfund sites in the country because we bother to look at all, right? That's why. And then when we look, we get them cleaned up, and it does take a long time. But why is that the case? Because Trenton was the seat of a historic pottery factory, right? And the ceramics and the work of glazing created lead particulates in the air that have found their ways into soils that have permeated for a long time, or not permeated, but have been bound in soils for a long time and have been present for a long time. But that doesn't mean we should just allow them to be there. Recently, we found them in some schoolyards, right? And then we have to close off those areas to kids who desperately need green and open spaces. And so this does occur in places throughout the state where we find this, but when we do, right, we make sure that we are addressing it. But I think a point of attention and advocacy, right, on this issue is important, right? To know the status of our schoolyards and our playgrounds, particularly in formerly industrialized areas of the state. So, for example, we find issues like this in places like Patterson because it was the seat of the birth of the Industrial Revolution for our country, right? We find it in places like Atlantic City as well. And to Dr. Baston's point, look, it's not a coincidence, right? It's not a coincidence that we find the highest risk of environmental exposures, right? That 85% of our health that Dr. Baston mentioned. It's not a coincidence. It's not a mistake. It should be obvious that we find these greatest sources of environmental risk to our health co-located, in the lowest wealth, blackest and brownest parts of our state and our country, right? That's an environmental injustice. And luckily, right? We are fortunate to work in an administration that has prioritized, right, furthering the promise of environmental justice, but it doesn't happen by itself, and it doesn't happen overnight, and it doesn't happen without accountability partners who hold us responsible for the values we articulate. So thank you for doing that.
And one last question, but I have to pause and say, I work all over the country. I work in my own state, Maryland, with 3 cabinet secretaries and.
Serena McCoy,
Yeah. I don't think I've seen this much coordination and leadership knowledge at this detail with the passion that you bring and the real actions that you're bringing as a collective anywhere in the country. And I think we are fortunate to have this. And so much to act on and unpack and get moving on that you raised today. But in 2018, with support from Fund New Jersey, we wrote a plan to help us all get moving in New Jersey. We are going to be rewriting and bringing that forward with everyone here and with you all. As we begin that work, tell us in your priority, your top 1, 2, or 3 priorities that we need to pay attention to or thinking about that can help, and what we can support you on to help us as you close out.
So I think Commissioner Suarez got this a little bit when she was referencing funding for lead days. We are in a period of historic federal investment in infrastructure, and particularly for me, for environmental infrastructure, water and air controls and contaminated site cleanup and all of those things. Right, we're lucky. Right, the Biden-Harris administration, I don't mean to be political, it's just true, has made these just seismic investments, and I'm grateful for that. But it's not enough. It's not nearly enough. Right, there is a amount of, I think, $7 to $10 billion nationally under the bipartisan infrastructure law to replace every lead service line in the country. I love that goal. It's going to cost us $3 billion just here in the state of New Jersey, right? And so, as we form that plan, I think the advice is bring in the legislative members. Right? They're forming a budget that we'll have to live with for the next year right now. Right? They'll vote on it tomorrow. It reduces the amount of water infrastructure investment by a small amount, right? To balance the budget. And that's okay. We've got to balance the budget. But as that federal funding phases out over the next 2 years, we're going to need a lot more as a state matter. And so I think that has to be a focus, at least from within the seat that I sit, and I'm happy to collaborate with you on what that looks like.
I think you made a point earlier that is so important, right? It's the transparency that has you fighting for Superfund sites. And by the way, if we can all help get that, we all want that to turn. But I think that's the thing that people do need to understand. The willingness as a public leader to say these are the problems that's articulated. That's how we build trust with communities, to tell the truth, right? And then what is it going to cost, right? Counselor, Doctor, Your Royal Highness.
Yeah, I like that.
Taylor Swift.
Yeah. Dye my hair.
Yeah.
I think, everything that's been said is certainly true. From my vantage point, I think one of the things is making sure that your voice is heard for the constituency that you are advocating for. Because as much as we don't want to admit it, especially in politics and government, it's the squeaky wheel that most often gets the oil. And so transparency is important, advocacy is really important. But from our perspective, since I've sat in the seat as the commissioner of the Department of Community Affairs, one of the things that I've noticed the most is quite often when we're responding quickly to a squeaky wheel, we come up with a Band-Aid approach. And while that's important in the moment, it's not a long-term solution to what our issues actually are. And so one of the big initiatives that we have, and while all of these that we're even talking about today are extraordinarily important, one of the initiatives that we have right now, and it just got through actually, it's the state rental assistance program to home ownership. And so this is gonna be transformative for the generational wealth gap across the state of New Jersey. Because for the first time, we're taking a holistic approach to renters who are home ownership ready, to figure out how do we break down the barriers of entry to them so that they get to live in a community that they choose. They get to build equity in their home that they can then utilize for their children in the future, tap into should they need it. And we're doing it from this approach of rental assistance is vital to make sure that people have a safe, stable place to call home. But it essentially is a Band-Aid in the sense that, yes, it's safe and stable as long as your lease is in effect. And then what happens if the landlord decides to sell that property, or they decide they want to move back to that property themselves, or whatever the case may be? Your entire family is uprooted, and 9 times out of 10, you're not going to be able to find other housing in that same community, in that same school district. And now your kids start from scratch all over again when they were stable and comfortable. So we're trying to figure out from our perspective, how is it that we get creative with our solutions that are going to actually change the root of the problem, as opposed to just ancillarily making things better in the short term. Because while that's also important, we need to think about what those long-term goals are going to be and how our investments in our community are going to have the greatest impact, because we all know we're going to have to make difficult decisions in the budget at some point. So we want to make long-lasting programmatic changes that are going to have ripple effects for generations to come. So that's one thing that we're looking at the Department of Community Affairs, and also partnering with all of our sister agencies to figure out what that looks like and how we do it. How do we build the supports for those needed, whether that's health, human services, environmental justice, and how do we make sure that this is going to be a long-term thing that's going to actually make it different for that family for the long term.
I think doctor does fit because it's thinking root cause holistic
Yeah.
to this, right? And that is, I mean, all I'm hearing here is the courage and common sense in many ways of what you're trying to move forward. And I was thinking about the low income heating assistance is the same issue. It's a short term pay for high bills, but are we fixing the longer term thing? So I think that shift is thinking is a shift in generational leaders too that are rising. So doctor, we're gonna have you bring it home, bring that all together and tell us thinking about priorities and where we should go together.
Okay, I'll do my best to bring it home. This has been a real treat to be up here with these folks, so thank you both. I think I want this interdepartmental collaboration that we're showing you here to be something that people hold in their minds. I have kind of 3 take homes and 3 asks, but one of them is we are doing all this work to rebuild community trust, and we need your help with that, because we really are working together in government, and we really are public servants, and especially the appointed people who are in these roles generally are from the ground, doing this work, experts in the fields, trying to get the money where it needs to go, trying to help people in the communities. And I think we get mixed up with politics sometimes, right? And we need to help rebuild that trust in public health. And I think through the pandemic, a lot of that eroded, and it got mixed in politics, and it doesn't belong there, because this is not for me. This is for the community that we're serving. And so we need your help to help rebuild their trust, and I will do my part, and we will do our part in public health to help that. One of the ways we're doing that is transparency. We talked about that. We talked about lowering these levels and doing what we can here and empowering communities. But one of our big projects, one of my big projects, is getting health information into the hands of the people whose information it is. I have brilliant epidemiologists in my department, like absolutely brilliant. And they'll dive into information and data, and they'll take all this data and they'll put them into maps and they'll figure things out. And that's incredible. And we need to it's our job to do what we did, where we built the story so that people can understand what that means for them and their neighborhoods and their communities. But one of our big projects is taking the same app that we had people hold their vaccination information on their phones and giving them their lead information there too. So that it's just easy to access. And I know not everybody has a phone, so I'm not naive to say like, oh, this is gonna help everybody. But what ends up happening is if we don't get the information out to people who do have phones, then we're trying to call everybody, and that doesn't make any sense, right? We'll never get through. But if we give everybody the information that we can get it to immediately and it's in their own hands, and I hear all this like, well, you know, what happens if we just give them their information? I'm like, then they can do something about it, you know? This idea that we as providers or people holding somebody else's information is gonna do better with it than they can when it's their own information, right, is disempowering. And that doesn't mean that I'm not here to help and walk you through and give you information. That is our job. I'm not trying to put it all on people, but I don't want to hold it from them. So our big initiative at Health is transparency. It's getting that information into the hands of the community, empowering them to say, whoa, your kid was positive, my kid was positive. Wait, where is this coming from, right? They are going to see it maybe even before we do. My epidemiologists are pretty good. They may see it, but I want it to be a two-way street in that way. So that's one of my big initiatives. And then my other one is, you know, help me rebuild that trust. Help me help people get that information into their own hands and see that. And then thirdly, help us rebuild health as a workforce and as a priority in public health and primary care. When you look at healthcare, and this is my pitch for the dollars, right? Everyone else got to make their pitch for the dollars. Here's my pitch for the dollars. And I know I'm a primary care doc, but we spend so much money bailing out the boat when someone has gone to the hospital because they had a stroke, when someone has gone to the hospital because they had something happen. And that is because we didn't do a good job upstream. And we need to make it easy because it's hard. I know how hard it is for me to get into my primary care doctor. And I am a doctor, and my husband is a doctor, and I have all the friends in the world to go around the system. And it's still really hard to get in. We have got to fix that, but we're never going to fix that unless it's lucrative to be in primary care, for hospitals and systems to invest in primary care, for us as a society to invest in public health and primary care. That's where the money should be. And we've seen other countries do this. They invest in primary care and public health and local public health and housing and food and all that 85% and the preventive care, and the overall costs go down and the quality of life goes up. It feels like common sense.
It is, but I think about the healthcare system and how little we pay pediatricians.
Yeah.
And how much we pay people.
Orthopedic surgeons.
Yeah, absolutely. But it's the same on teachers and how we do this, right? What is on the fundamental? But I have to say, I think constancy and consistency build trust, transparency builds trust. Putting information in people's hands so they know what the truth is the groundbreaker of that. So I got good word. If you're willing to want to open it up for a few questions or comments or anything from the audience, yes, Heather. If you,
yeah,
I got a yes. Okay, sorry.
Hi, Heather Sordy, Free New Jersey Program Manager. I just wanted to say thank you to GHHI for this opportunity today. This has really been just a great conversation. And I want to thank all of you. You know, it's been great working with all of you. You've all opened up your offices and been very receptive to meeting with us. And, you know, one thing I want to offer, I hear, and I'm so happy to hear the community involvement, right, CRY. And what I can say is 2 of our Free New Jersey community public meetings are here today, one for South Jersey. And we do have 4 of those. And, you know, I know that they are ready and willing to work on the ground to bring the messaging and to provide the feedback of the lived experience, because so often I think that that's what's really missing. And just a shout out to Ruth Ann and GHHI for bringing that. We have all of our health committees and housing and water represented. GHHI chairs our housing committee. So super grateful to them for that. Just wanted to say thank you for all the work that you're doing. And you know, we want to help in any way possible, and thank you to all of our partners.
Thank you very much.
Thank you.
Does somebody have a question? Thank you. Questions? I mean, they're pitching for dollars over here. You guys want to pitch for dollars or policies? Yes, ma'am.
I don't really need this, but okay.
Introduce yourself.
My name is Norl Whites, and I'm from the cooperative, and I've been in this business for a long, long time. And it's, first of all, wonderful to see the passion and the coordination, collaboration. I know a lot of lip services giving to breaking down silos, but unfortunately, we don't always see the evidence of that. So wonderful, wonderful to see. And a couple of things about sort of community voice and community involvement in particular. You know, when I started in the cooperative, it was 2001, and I was sent to Baltimore to learn about the lead kits, right? And one of the things that they told us was, you know, we're not getting them back, we're not getting them out, and I think so often good intention efforts are not understood or now distrusted. And when Department of Health, you know, invested in the White Out Lead program, honestly, they said to me, this will be a year, you know, a year ago. But what was happening was it was creating a pool of potential applicants for the Lead Hazard Control Assistance Fund at the time, which similar problem was not being utilized. So we actually trained one of our staff to assist with the applications because these came to me and said, you know, after health, you know, unfortunately it ended the support. And they came to us and said, you know, this is applicants. And we actually trained someone to sit down with folks and actually go through the application. And one thing I will, you know, experience of hindsight, right? One of the big issues was their eligibility, whether it was maybe it's liens on properties or, you know, similarly in the housing situation on here on our community networks, you know, their criminal record from 30 years ago, whatever it is, right? So just that particular piece. And we know we've during the COVID and also in some of our recent work, we train ambassadors, parent ambassadors, so members of the community, and we actually had them use their social media. And it was incredibly difficult because it introduced all kinds of bots and AI, but we learned how to read the data better. And it's really a wonderful way to engage the community. And I would tell you that when COVID used the texting program, a lot of efforts in South Jersey were at Camden, right? You know, Camden had testing, and because we had that grant too, on every corner, and their rates were good, but the rest of South Jersey was struggling. So actually, we created a grant for the southern counties, and I said, you know, they're doing texting here, why can't we bring that there? And the difference in the rates of people coming in for their COVID vaccine was incredible. We saw such a huge impact. So I think your idea is, you know, brilliant. It makes things more difficult. I will tell you, there's all kinds of unique challenges. And the last thing I'll say is in terms of your positions, and I have to say, I don't have that poisoning in my practice. We haven't had anybody with lead poisoning in so long. So first of all, are you asking? A. B. I actually got him on the phone and showed him and picked a very affluent community and said, really? Because look at the housing stock in your community, you know, and he was completely floored. So I
Thank you for that.
yeah, I think, yeah, it was a lot of fun for me too, let me tell you. He was providing another area where education is needed.
Well, thank you.
I think the point of that is the importance of navigators, the importance of ambassadors, outcome brokers, right? And it's going to be increasingly important as you get more tax credits when you come through the state and different things from the federal money. How do we align all of these things? How do we put that together? You look like
I think you have
I
one
do
more
have
question.
one more question. This is our last question of the day. Oh, we have two? Okay. I'm going to my friend Monique first here and then my friend Tricia.
All right, good morning, guys. My name is Walker. I'm one of the public health nurses in the city of Trenton. I'm actually hard with public speakers, so please bear with me. So my concern is that a lot of our cases, our families are, we're having a larger population, of course. So we try to advocate for our families, of course, the children level is the higher level. We're seeing that here at the varsity. So the main problem that we're coming across now is that we're encouraging our parents, the mothers, to get tested as well. But the doctors were getting pushback with physicians telling them because the child already has an elevation, it's not necessary. But we do know that older, the parents can encourage that higher level themselves, and that stays in the system in their phones. We try to educate that to them, but the physicians are not, they're not doing that. So how can we advocate for our families to try to go forward? Yes, we're getting the child tested, we're getting them treated, we're getting their levels down, but these schools are still there for mom.
That's right. No, that's brilliant and such a good from the ground experience. I think partnership, I love that you asked the question, and if you don't mind, reach out to health, because we have a microphone that I'm happy to use for things like this. And we can reach out to providers. You know, docs they're tough, you know, we're tough, Yeah, we're tough. But sometimes doctors will listen to other doctors. I always do that, like, right, when I'm doing police education, I'm like, yo, Pat Callahan, can you talk to your police for me, right? They're like, who is this family doctor being like, oh, sure, she gets my job, right? They can't. So we do need to use our own each ambassadors to talk to our groups. So I will happily reach out to the physicians and do some of that education. We can reach out to the Primary Care Association and talk about it. And we also probably can lean on, we can talk to our Medicaid colleagues and see what's covered and what's available. Because a lot of times the pushback from medical is the pushback they get themselves. And it's so frustrating because you never know where from the system it's breaking down, right? It could be that doctors are like, oh, I'm not going to order this med, but that's because they know the insurance won't cover it. And then the patient's going to get a bill for $300. So it ends up backing into driving the way they practice. And so we can look at that and try to identify where the system breaks down. And that's true for like some of the requirements that don't make any sense too. A lot of times we do have people from the ground and we are listening to the community and we know that it won't work. And yet somebody's making that requirement somewhere that we can't change, right? So that's part of why we need this partnership. And I learned this early in my career that, you know, you can talk to people and they'll focus on all the ways something can't happen because there are so many barriers and it's so frustrating. And it's what we see every day is all the walls. And I'm like, then we got to keep looking and we got to find the window, right? You're like working your way through a maze every day. But if we can find it, we have really dedicated people, we really can navigate the maze of a system, you know, until maybe we blow it all up. But today, right? That's like tomorrow, we'll blow it up. Today, we got to navigate this together. So thank you for your partnership.
That's an amazing question. Probably right here, for sure. And I think you're the last question today.
Hi, good morning. My name is Trisha. I'm from Green and Health Initiative. So I have a question for DP. So I've been observing lately, and of course it's that time of the year. Is there any strict policies around mosquitoes, like catch basins around distributing mosquito repellents or any programs around it?
Programs around that distribute repellents or that restrict the use of repellents? I'm not sure that I follow the question.
Well, to distribute mosquito repellents or
Healthy ones.
or apply mosquito repellents in the catch basins.
In the catch basin. So the way that it tends to work, there's this thing called Mosquito Control Commission, because of course there's always and the Mosquito Control Commission distributes funding and very high level guidance to the counties, right? And so the application is usually, and sometimes be run locally, municipally, but usually is a county level exercise through whether it's a county mosquito control office, often an offshoot of the county Department of Health, right? And they'll determine where they have hotspots and how they're going to use it. Are they going to do aerial spraying? Not my favorite. For lots of different reasons. We read that. But whether there are particular problematic areas of standing water, particular stagnant water bodies, or like defunct stormwater control basins, a stormwater control basin should not have standing water, right? Has to drain after within a few hours of 12 maybe of a rain event, right? And so if in your communities you are seeing that standing water, that is something that you should report 2 places, right? Number 1, to your town. Number 2, to me, so there is a hotline, right? And there's also an app, right, called Warn DEP. Tell on people, y'all.
And thank you for your question, and just the breadth of things that you have to know in collective jobs. Thank you again for your brilliance, for your courage, for your transparency, and most of all, that you care to get to the solutions. You all are truly brilliant and amazing assets for the state of New Jersey and set such national examples in your work. So thank you very, very much. Let's thank them for doing this. We're gonna do a person. We're gonna stand right over here.
It's a public health issue.
But we are gonna take a 10-minute break and we will be back with another brilliant panel.
I literally am only here.
Do we get a picture?
Is there coffee? His name was Gary B. He was like, B-I-N. Oh, B. I know what it is. Okay, I haven't met him. Okay. Here. Yeah, so we do buy a lot. Yeah. We're at University Hospital right now. It's not just these are amazing. You have your own. You want me to write it down and give it my email? All right. Okay. Norton, Nortln. Email me your okay. Great. It was really nice meeting you. You too. I hope this was good.
Thank you, and I'm sorry. Oh, yeah. Yeah, I said, that's good, that's good. Almost. Not at all. Oh, I can't wait to see what you're going to be excited. That is the live stream. Who's at your microphone? This is the live stream. These are your microphones. If you want to, I don't have to. Muted right now. Sorry, they be muted right now. No. They just, yeah, they got it back there. Yeah. I get that.
Okay, everybody, we find our seats. We're going to the first plenary session here. All right, thank you, everybody. Like we'll have some folks filtering back into the room here, but we want to keep this moving. Again, I'm Bert Cooper. I'm the Vice President of State and Local Strategic Services for GHHI and pleasure of working in New Jersey, as I mentioned earlier. Excited about this next panel entitled "The Intersection of Healthy Housing and Climate: The Whole House Approach." It's an opportunity for us to I think do a little bit of learning about that intersection between climate and health, and to learn certainly what HUD is doing, the steps that the state are taking around climate and greenhouse gas reduction, particularly as it relates to our residential housing stock. And so we're going to hear first from Joe Miller, who's a representative of the Department of Housing and Urban Development and works with our colleagues at the Office of Lead Hazard Control, Healthy Housing or Healthy Homes. Joe has over 25 years of experience in public health, affordable housing, and environmental sustainability. And we're extremely happy to have her as she is a member of HUD's Climate and Environmental Justice Leadership Team and is on the President's Task Force for Environmental Health Risks and Safety Risks for Children. And I know she's had a busy week, which she'll explain why, with some opportunities that we're hoping some of our partners in New Jersey will take advantage of. So we'll start with her, and then we'll hear from Elaine Barr, who's the Bureau Chief of Climate Change and Clean Energy at the New Jersey Department of Environmental Protection. In her role, she champions creative policies to tackle climate change, encourages sustainability, develops initiatives and partnerships to put New Jersey on a path to achieve its ambitious greenhouse gas reduction goals. We're very excited about her work, given and she'll be explaining some of the goals they have set around electrification and some other greenhouse gas related measures they're taking that pertain to the housing stock in the state. And there'll be all sorts of opportunities to advance the work we're hoping that we're doing in New Jersey called the Trenton Home Initiative. So they'll explain those goals, and I'll explain a model that we're pursuing in Trenton to realize healthy housing and greenhouse gas emission goals. So that's the plan we've got moving forward. And with that, I will hand it over to you.
Thank you. I do want to say thank you for inviting us here today. HUD, initially, Matt Ammon, our director for the Office of Lead Hazard Control and Healthy Homes, planning on being here. At the last minute, he was called into some very important budget meetings, and he was unable to attend, and he asked me to come. And so he sends his greetings and apologizes for not being here. So he loves being out in the field. He's looking forward to being here and seeing all of you. And I'm delighted to be here. So, hello. So we're talking about the intersection of healthy homes and climate change today, and a whole home approach. Perfect. This is basically what our new mission statement, a little more simple from what it's been in the past and what our office does. And we will be talking about the whole of HUD. I work with the Office of Lead Hazard Control and Healthy Homes. We award grants to state, tribal units, nonprofits, local government to reduce health and safety hazards in homes. We also monitor and enforce HUD's lead safe housing rules and some other regulatory elements. We also conduct public outreach, and we do several studies. We have healthy homes technical studies, and we have lead technical studies. We'll know about that in the future. All right. This is one of the things that we were just talking about earlier this week. We announced that we released almost $500 million just for our lead hazard control grant. Yes, that's exciting. For those of us, and Ruth Ann is one that have been around since we started these funds, there was very little when we initially started, and we've been fighting for a long time to continue to invest in lead hazard reduction. Is it enough? No. Is it what we've been fighting for to continually increase it? Yes. Is this unprecedented? Yes. So we want to make sure that you all are looking at this funding, that you're seeking this funding. And one of the things somebody said earlier, and I think it was Sean who said this, that there's this ARPA funding that everybody's looking at spending down. There's a lot of funding out there. And our lead hazard control grants are not, we have a lot of money out there. Many of our grantees are trying to spend both their ARPA funding and their lead hazard control grants. The lead hazard control grants aren't as competitive as they are going to be next year and the following year. If you're going to apply for a grant, this would be a good year to apply for a lead hazard control grant. All right. We have a few others I'm going to be talking about as well. All right. So HUD is pursuing environmental justice. This is one of our key focuses for the entire organization. We're focused on advancing sustainable communities. We want to reduce exposure to health risks, environmental hazards, substandard housing, low-income households, especially in communities of color. And this, again, is throughout HUD. This is a broad goal for HUD, and our office has been pushing that throughout the last 50 years. And it's been integrated further and further and further throughout HUD. So HUD is advancing sustainable communities by strengthening climate resilience, energy efficiency, promoting environmental justice, and recognizing housing's role as essential to health. This is a quote on HUD's website. And we've been, again, we, the collective we, I'm talking about the community. And let me back up for a second. I've been with HUD, the federal government, for a little over, not quite 2 years. Prior to that, I worked, as you guys did, I worked for the last nearly 3 decades. I started out as a neighborhood coordinator for the lead hazard control program, the first year that it started, going out into the community, trying to convince people that we had free money in North Minneapolis, that we're going to give them free money and put windows in their homes, and building trust that the government was going to come in and put windows in their homes was very difficult. So finding people that already had that trust, building those ambassadors, building those programs was an incredible task. And it was a great learning ground for me. Then I became a program manager for our lead programs and our healthy homes programs. And I worked for our local nonprofit that did weatherization, energy efficiency, and integrated our lead and healthy homes programs. Then I became a consultant, worked with programs all over the country to implement these healthy homes, weatherization, and other housing and environmental programs. And then I came to HUD so that I could work from the inside to make these things happen. So I'm very excited to be here. I'm very excited to be talking to you about this. So when my enthusiasm shows through about getting these resources into the community, please know that I'm working from the inside out. I want to get this into your communities. This is being recorded, right? All right. So I'm not going to go through this in a lot of detail, but this is and these slides will be available to you. So we're celebrating our 25th year for the Healthy Homes Initiative. And we started out again at the Lead Hazard Control Program. And 25 years ago, this April, we started the Healthy Homes Initiative. So again, we started out as a lead hazard control program. And why did we start out as a lead hazard control program? Because over 33 million homes, American households, have children. So these are just the households that have children under the age of 6 that have lead hazards and that are exposing children. Of course, lead hazards, as we've all heard, are exposing children, and it's completely preventable. Lead remediation projects, when we do remediate lead, when we abate lead in homes, it not only impacts that family and that child, but it impacts generations to come. And when we protect a family, when we protect a child, it protects that child. It's like woman, we've heard about how it's impacting women and pregnancies and child mortality and women's mortality throughout the life of that child and that woman. And so again, it not just protects the people that are living in that house and the next family that lives in that house, but it protects the generation after generation after generation. The impacts we make when we intervene within a home is invaluable. You know, we try to put a dollar amount on it. We try to show what that return on investment is for those people that don't understand the value of people, and they understand the value of a dollar, but we understand the value of people, right? So we're trying to invest these resources in people. So what's HUD's role in safeguarding public health in our Healthy Homes Initiative? Well, we're raising awareness, we're making home improvements, we've reduced the blood lead levels. We're partnering with EPA and CDC and others in reducing lead poisoning. We're reducing asthma. We're reducing exposure to other environmental hazards. And you can see here, and I know this is small, and again, you'll get the slides, but I want to show you, like, we started out really slow. We did, 1, 2, 99, 2000, 2008. And then 2012, then we kicked it in. 2004, I mean, 2020 to this year. My flight got in at about 1:30 this morning, so anyway, and I wish I could have a lot more. Even this week, I had about 6 different things that happened this week moving forward for healthy homes, lead hazard control. It's amazing. We are moving forward. That snowball that we kicked off in 1999 is getting like 3/4 down that hill, and it is huge. So it's really exciting to be at HUD right now and to see the progress that we're making. So the federal government, the agencies that we wished could work together are starting to work together much better. We have MOUs, we have pilot projects trying to share data. Is it perfect? No. Is it better? Yes. We have an MOU that reaffirmed our agreement from 1997. For those of you that were around, we were so excited. Oh, we reaffirmed it again. You know, we have so much work to do, but we are doing so much. And there's a lot of links that I put in here so you can find out more. Little time here. So we're here to talk about whole home and the healthy home approach. So backing up just really quickly for those of you, what is a healthy home? You know, it's keeping it dry, keeping it safe, keeping it clean and uncluttered. I'm gonna do two things at once so I can watch this instead of turning around watching it with you. And pest-free, well maintained, contaminant-free, and thermally controlled. And what do we mean by these things? When we say keeping it dry, it's, you know, making sure that the roof doesn't leak, making sure we have drainage away from the property, making sure that we're keeping up their plumbing leaks and we're checking things out, making sure that, you know, when it's safe, that it's safe that we're keeping, you know, poisons away from children, that, you know, sharp edges in playrooms or where children play are, you know, they're away from children, that it's clean and uncluttered. We don't have, you know, loose rugs where people could trip. We're watching trips and falls areas. It's well ventilated, that we're bringing in air from the outside if possible, that bathrooms are ventilated, kitchens are ventilated, and if possible, that we have full home ventilation. And that, if possible, is a big if possible. That's really difficult in multifamily units. Does have a lot of new policies around that for the public housing, for multifamily units, and our office is working on some of those things with public housing. But when possible, whole home ventilation. Pest-free, we're talking about, you know, filling up cracks, making sure that if you do have, you know, mice or roaches or bed bugs, that there's ways that you're taking care of it and you're doing it in a way that's the least toxic way possible. And you're using integrated pest management if possible. Contaminant free, we're talking about radon, lead. With radon, as most of you may know, radon is a second leading cause of cancer. And it is a high impact, you know, no odor killer with a relatively easy solution. You want to keep it well maintained. Small problems can become big, costly issues, both health issues and costly issues for the home. And then thermally controlled. That's something that we're hearing a lot about right now, isn't it? We're seeing all these extreme heat events. Extreme heat is the #1 weather killer in the United States. And we're seeing that happen right now. If you cannot control the temperature within your home, you are at risk. And unfortunately, the people that are most at risk will die in their home. People think, you know, oh, it's a heat event. People that are outside, that are doing sports, that are working outside are the ones that are most at risk. No, it's those that are most vulnerable, that can't leave their home or don't leave their home, that are ones that die in the home. And so being able to keep your home cool, and oftentimes people that are least able to afford an air conditioner don't have one. And even the ones that do have an air conditioner that aren't able to afford electricity, they'll try to keep their air conditioning off until it's too late. So we want to be able to make sure that they're able to afford it, that they have, that their properties are energy efficient, and that they're not creating more greenhouse gases in that effort to remain cool and alive. So, all right, so what are the co-benefits for healthy homes and climate adaptation for a whole home approach? There are many. Climate change and affordable housing crisis are, you know, inextricably intertwined. Our housing stock is a major contributor to climate change and greenhouse gases. Residential buildings account for about 20% of greenhouse gases emissions. And most of the housing is kind of gray housing, which serves as kind of a immediate and necessary function for shelter, but it's often energy inefficient. And so combining healthy housing, weatherization, and energy efficiency has always been a goal of our office. Our office has required energy efficient windows and doors, and any of you who have been a lead hazard control grantee or a healthy homes grantee know that. And we've worked tirelessly to try to get weatherization and healthy homes and lead hazard control programs to work together. And unfortunately, there are a lot of barriers to that. Simple things like income verification. The federal government doesn't have, people nodding, doesn't have one way to verify income. And it is an incredible barrier. We're working on it, and we know that that's a barrier. You know, we're working on it. And that's, you know, some of our agreements and sharing data and looking at ways that we can do a better job. And in fact, the weatherization and healthy homes demonstration project funding just went out yesterday, I believe. And so that project is for weatherization programs and healthy homes production grantees to work together. And they have, we have an agreement with DOE to have one income verification process to see how that would work. That's from Congress. They wanted to see if that would work. We don't have a lot of applicants for that. So there's reasons for that. So we'll see how that goes. So if you want to apply. All right. Thank you. All right, we know climate change and vulnerabilities go hand in hand. We have extreme weather events, heat stress, air quality, resiliency. This is I remember where I got this. I think on CDC or AHA. It's, you know, you have injury, mortality, heat illness, respiratory disease. These are all vulnerabilities, and they're often in the communities that we see. Somebody already talked about how the communities that we serve are often the ones that are most impacted by climate change. And so when we see the impact of climate change and we see the 8 principles of healthy homes, we see that overlap. We see extreme heat and we see thermal control. We see air quality and we see ventilation. You can see how healthy homes and climate resilience and climate adaptation go hand in hand. Some data here. All right, so what are we doing to advance climate resilience in our most vulnerable communities? I have a few links here on HUD. We have Extreme Heat Quick Guide. The HUD Exchange has a lot of information on Build for the Future. We have some evidence, matters, climate and housing, and children's healthy development. Again, we have some interagency collaboration. HUD prioritizes resilient, efficient, and green homes and community development, and our office is part of that. Again, back to that weatherization and healthy homes partnering together. And this is one of the exciting areas. We have a program, a whole office on Build for the Future. And it's not just build for the future. It is adapt for the future. So I want this, you know, I think that this language is a little frustrating because we're not just building homes. And that's what oftentimes people think about is this development, this HUD development, developing more public housing. But this is building our souls, building our communities, building for health. And so we're building our resilience, we're building our adaptation, we're looking at energy efficiency, renewables, resiliency, and environmental justice. And that resiliency and environmental justice are where we're at. We're looking at ways that we can build community resiliency, adaptation in community. Our Healthy Homes programs do allow for communities to look at the home and see, you know, can that community address some of the adaptation issues. We do award a Excellence in Healthy Homes Secretary's Award every year. We're going through that right now. We have a bunch of nominees, but when we talk about whole home approach, this was our awardee last year. They actually use some Medicaid dollars and a variety of other federal funding. And with those Medicaid dollars, they're able to take out the property owners or rental, take out all of the belongings, put it in a pod, And if you've worked and done any lead hazard control or healthy homes projects, you're just saying, oh, that's a dream. They move it all out, and then they can get in weatherization, healthy homes, lead hazard control, electricians, everybody, and they do a full home approach. And they don't have a cap with the Medicaid dollars. They can use a bunch of different funding too. They use CDBG and other funding, and they do these larger farmhouses too, because they're in more of a rural area. The amount of money that they put into these homes is incredible, but then they will last. These homes are 100 years old, some of them, and they last generation after generation after generation to come, and they are solid, wonderful homes. So they're great projects. You can look on there, but they do a full home, full family approach, and many of them have multiple generations living in those homes. They do smaller homes too, but I just thought it was amazing that they could do some of those larger homes as well. We are working with the Building Performance Association and combining our Healthy Homes national conferences with the Building Performance Association. This is new. What's really exciting is that we have weatherization, energy, businesses that are in that arena, along with our grantees and our office coming together for these conferences. They come to our sessions, we go to their sessions, and it's really opened up communication and strategy. We'll be in New Orleans next year. And then this is just one of our grantees, Miss Charlotte. She was caring for her family and caring for her grandchild. She had lead hazards, fall hazards, severe mold. She had a tarp over half of her roof. And she got that from her church. And that was the biggest thing that she could get help with. And she tried everything. And she'd practically given up. She had given up. And she took care of everybody in the community. She's one of those people, you come in, if you need food, you come in, I'll take care of you. Everybody moves in Charlotte. And an old AC unit, she lived in Tennessee, and it tripped electricity every time. And she turned it on. Her doors were unsecure, her windows were unsecure. And she heard about our Lead and Healthy Homes program in her church. And she said, one more time. She didn't believe it, anybody was. And then she remold, and the pandemic hit. So it was delayed. She thought that's it. And she was losing her hearing. She had started to lose balance. And for her grandchild, is how she was eligible for lead. Well, they were able to enroll her, got her going, and they came in and they ripped out the roof with just mold everywhere, mold in the floorboard. They said, Charlotte will take me out of here. They moved her out, relocated her to new roof, new ceiling and walls. They were able to do the Healthy Home supplemental funding. They were able to do electrical, floors, roof, hand railing, because both her and her mom had fallen down the stairs outside, secure window, secure door. And one of the interesting things was not only did it protect her grandchild from lead, not only does she have a cool place where she's safe, or her mom is safe, she got her hearing back. She got her balance back. It's inflammation from the mold. Nobody expected that. Not even her doctor. Nobody. She didn't expect it that bad. So you never know what kind of impact you're making on somebody's life. We were doing this for the child. We were doing this to save the house. She has a funny story about her and her daughter driving down the road, coming home from church. She drove right past her house. She said they were laughing because they used to be the ugliest house on the block, she said, and now it's the most beautiful one. She doesn't even recognize her own house. We can make a difference in lives, make a difference in communities and neighborhoods. So we have a lot of programs out there. We have an older adult home modification program, the homes grant. We have a lead hazard control grant. And one of the ones that I want to make sure that you know about is we have a lead capacity building grant where you can get money for those community ambassadors. Develop your workforce. You can have 2 years to look at the kind of coalitions that you want to build to do a lead hazard control program. That last year is when you would be doing your lead work. You do just a few units and then start applying for your lead hazard control grant, healthy homes grants, etc. Whatever information you need about any of these funds, how they might grade with other funding, please feel free to ask. Thanks very much.
That was the healthy housing side of of the world, and many of the resources that we're going to be looking to bring as we advance a whole house model. Can you talk a little bit just about the climate goals the state's pursuing and how those are touching us?
I think.
There you go.
Hi, so hello again, my name is Colleen. I manage the climate change and clean energy program at the Department of Environmental Protection. I've been there for about 8 years and I've really been on this climate journey. That wasn't my background originally. I was a water infrastructure person, so I've learned a lot, especially about homes and how important this is. And then I am a lifelong New Jersey resident. My family born and raised in Trenton. My great grandfather worked in pottery factories there, so that was fascinating to me to hear. I'm like, thanks so much about my dad. Anyway, so I'm a big science nerd, data nerd. I thought I could just maybe take this really big level, you know, what are the challenges in the state's facing right now with reducing our greenhouse gases, and kind of drilling down into what are the opportunities and the great funding that's on the streets today. So, right, to quote Peter Drucker, you cannot manage what you don't measure. So the state for the last 20 some odd years has been doing a greenhouse gas inventory, really digging down every year, looking to see what are the sources of emissions in the state. You can see since the early 2000s, you know, our emissions have sort of begun to drop over time. And the state has had 3 very big, ambitious greenhouse gas reduction goals. The first one we've met, which is awesome. So we had a goal to reduce emissions back to our 1990 levels in 2020. And you can see that's the first sort of high dot that doesn't have a line attached to it, that we made it by a good margin as well. So that's exciting. But man, do we have some work ahead of us. We have even more ambitious goals now that the state is, you know, hoping to achieve by 2030. So in 6 short years, we're hoping to cut our emissions by 50%. It's a huge, huge undertaking, and I know I'm probably preaching to the choir here, but everybody, like literally everybody, every person in New Jersey needs to like know about that goal and be thinking about it and like making those life changes to help us get there. Because it can't just be like the small team at the state government level. It can't even just be your municipality. Truly, it's every single person. Our next goal, even more ambitious, I think I'll probably still be at the department, which is scary. Like 2050 goal, right? So we're trying to cut emissions 80% by 2050. That's even bigger. So these, you know, really big, ambitious goals for us to try to cut our emissions. So when we dig down a little deeper now into the data, well, what does that mean? Where are our emissions coming from here in New Jersey? So there's primarily 3 really big areas that we have to tackle. The first being transportation. So this is the way that you and me commute every single day. It's primarily all of the cars and trucks on the road. And we all know there's a lot of air pollution that happens. There's a lot of impacts to our Black and brown communities here in the state from that traffic in and around their communities, safety hazards, people that are dying because of car accidents, right? There's just so many problems in transportation alone that we can talk about. So the state's been doing a lot around vehicle electrification, you know, hoping, you know, to try to push and nudge that forward. We have a lot of great regulations on the books. So, you know, I'm really actually super confident that we're going to cut our transportation emissions. The second biggest goal or target here that you see is buildings. So we've combined commercial and residential, and collectively those 2 are the second biggest bucket of emissions. I'll talk a little bit about them a bit more since that's what we're focused today on the next slide. But then the third one is electric generation, right? So all those little electrons coming through the wires to our homes to like turn on our TV and our air conditioning, things like that. We have really big, ambitious clean energy targets in the state. We're going to be building offshore wind. We are rolling out huge solar programs, community solar. We just got a huge grant from the federal government to help improve our grid, to make sure more folks can take advantage of community solar programs. So I'm also really confident we're going to get to clean energy here in the state in our lifetime, which is awesome. So that means every time we plug something into the grid, it's going to be clean, carbon-free, no fossil fuel emissions, which is wonderful. So now to talk a little bit about residential, right? So where are our emissions coming from? You know, before I took this job, I didn't really think about it, to be honest. I just did it, you know, sustainability person, but like, you know, every day you're just, you know, you're living your life. I'm turning on the heat, I'm turning on the AC, I'm not worried about it. When we look at New Jersey, the vast majority of the emissions are really coming from how we heat our homes and how we heat our hot water, period. It's kind of 2 pieces of equipment in our buildings, in our built life that we have to think about. In New Jersey, we're really close to Pennsylvania, really close to a lot of natural gas resources. About 87% of our housing is hooked onto natural gas, right? So that is a challenge, right? And natural gas is, historically cheaper, lower cost. So we need to sort of think creatively about how are we going to, unpair our heating from that cheap energy resource. And really, what is that solution? And that solution comes through and connects very strongly with the work that all of you are doing, right? It's really about that whole home. It's about how can we make our homes healthier? How can we make them more energy efficient? How can we really change the housing stock in New Jersey, which we've all, you all have been working on for your careers. So that solution is electrification. And it really is thinking about how can we plug in and use different types of technology to heat our homes. And what's really cool is that technology, as folks heard of heat pumps? Did they have a heat pump? Right? I'm actually hoping to get a quote for one day. So heat pumps do really awesome work because they actually heat and cool despite their name, which does not seem like they would. So what they do is they displace heat from one location to another. And you can use them for AC, right, in the summer, and you can use them for heating in the winter. And that's really wonderful. We're thinking about the challenges that climate change pose, right? We just heard heat is the number one risk for folks in New Jersey and the United States. Being able to upgrade your heating system to a heat pump means that you then will have on hand and better AC and temperature control. There's also heat pumps for water heaters, right? So not only do you have to have an electric water heater that might be not as efficient, heat pump water heaters are super energy efficient, thereby cutting your energy bill as well. So those are sort of the two areas that the state has really been thinking about and trying to focus a lot of resources on. I know that often with building decarbonization, climate work, people are like, oh, you're stealing our gas stoves. We're not. We're not trying to, right? We're really trying to just focus on the heating equipment, right? And getting your home as energy efficient as possible. But beyond climate, right? And I think this is really the sphere that some of you work in. I mean, there's just so many more benefits to doing this type of work. One is energy burden. 1 in 4 households face really high energy burden, meaning more than 6% of their income is going to pay their energy bills. So by creating more energy efficient buildings, by having new appliances that use less energy anyway to heat and cool your water and your air, you're going to reduce that energy burden. Health is also a major concern, right? These fossil appliances directly emit CO2, nitrous oxides, right into your environment, right? We spend 90% of our lives in buildings. That's the reality. That's the air that we're breathing, right? So taking out those fossil equipment means that we're improving the health of our children, of our elderly folks, and decreasing risk of asthma, heart, and respiratory issues. And then jobs as well. I'm going to look at my notes for this one. So back in 2022, we did a big study at the state looking at what are the green jobs potential, right? We're talking about converting 90% of the residences in New Jersey, so that's about 3.4 million housing units, to electric heating, hot water heating. And what does that mean for jobs? I mean, it's a potential opportunity, especially for folks that maybe have historically been left out of the construction and job market. We're talking about, at least in the next 10 years, over 100,000 jobs alone, just between electricians, different types of metal fabricators, maintenance, and repair folks. So there's a huge opportunity to also provide jobs, for folks that really need them through this transition. So we've done all this modeling, right? About 90% of our housing stock needs to become electrified between now and 2050. So what is the state doing to really achieve this? So we've kind of taken bites, right? Like you can't eat the whale in one bite. You have to kind of do a little bit at a time. So we've made 3 significant commitments in the last couple of years. The first one, Governor Murphy signed Executive Order 316, which set up near-term targets for installing electric heat and hot water heating in residential and commercial buildings, as well as committing to 10% of low and moderate income households being electric ready. And so what does that mean? It means having upgrades to your electrical service and your panels to ensure that you can, when your time is ready for you, you know, if there's an end of life for your appliance, you can easily just plug it in and it's not like a, oh no, like I need to replace in kind situation because it's an emergency, right? We're trying to avoid that. Because every time we, you know, put in another fossil fuel piece of equipment in our home, it's there for the next 20 to 25 years. So we're just trying to break that cycle of locking in emissions in the long term. And by making our homes electric ready, that's how we're going to do that. Further, the state has signed on to 2 multi-state commitments, one with the United States Climate Alliance to install about 30 million heat pumps between now and 2030, and then another one with NESCOM, which is a bit of a mouthful, but it's the Northeast states for coordinated air use management. So we've committed through there to achieve a 65% adoption of heat pumps by 2030 and 90% by 2040 collectively. And we're working on a multi-state action plan with NESCOM about how we're really going to do that. And that should be released sometime in the next year. We have an environmental justice committee that's advising on that, right? Because so much of this is we want to make sure that it's just not the wealthy homeowners that are experiencing green and sustainable homes. Like that is a right for everybody in the world, right? We should all be living in healthy homes, in green homes, sustainable, low energy, low cost. Yeah. So we're working on that. The state is also working on the buildings roadmap, which I'm going to ask that we call the buildings blueprint. And so we're working on that. Hopefully in 2024 will also be released, and that's really going to target EO16 and how we get to those interim targets in the near term. So next slide. So what are some of the opportunities here, right? So there's lots of plans, lots of commitments. Where's the money? We like to talk about. So I'm just going to touch on a few of them. There's a lot more going on out there, but through the IRA, which we've heard so much about, right? The federal government made an unprecedented investment in climate action. You know, over $9 billion alone between 2 particular programs known as Homes and Here. So what is New Jersey's plans for that? You know, we're going to be getting, you know, multiple hundreds of millions of dollars to invest. And there's 2 programs that we're currently pitching through a straw proposal through the Board of Public Utilities. So the first one is called MRISE, and that's going to target garden style apartments and mid and high rise buildings where at least 50% of the tenants are low income. And it will be able to fund wall insulation, dock repairs, air source heat pumps, heat pump water heaters, lighting upgrades. And it would cover up to 80% of the project costs for $4,000 per dwelling unit. And that can be stacked or rated with other incentives out there on the market through either through the tax credits, or other, you know, healthy home initiatives, or through the utility programs. The other major investment the state is looking in right now to do is through Comfort Partners, which is, you know, our free program for income eligible customers to reduce their utility bills. They're going to be adding an electrification adder to that, which means that not only are going to do their traditional energy efficiency and weatherization work, but they're also going to be doing this electrification piece and adding funding for that. The third major funding source is here in New Jersey. We actually have energy efficiency targets that each utility has to achieve annually. And they are now running their own very aggressive incentive programs, right? So wherever you live, you have an electric utility or a gas utility, and you can work with them to get additional funding on top of these state opportunities to do this type of work. And they're trying to, what it's called is starting in January of 2025. I mean, you will probably be spammed by the amount of outreach your utility will be doing to you, but it's not a lie. They have this money. They want to come and work in homes and do this type of work. And then in terms of tools, you know, as you guys are thinking about this or working in the community, what are some of the tools that are out there or going to be coming online soon? The department just released a solar siting tool. So if you're thinking about, you know, the big picture, you want a healthy home, you want renewable energy, we have a solar siting tool on the market out there that you can take a peek and play with and sort of see, you know, what's available for siting solar in your communities, particularly around community solar. We're also working in partnership with the Board of Public Utilities with this clean heating and cooling calculator, which actually will pull in all the different utilities and incentive programs to tell you how much money you would get and what your return on investment would be from switching out your heating and cooling equipment. We have to try to really bottom line for people and help them understand, like, okay, if I do this, I'll get X amount of money back, right, to help that. And then the last thing we're working on, well, is bigger systems, right? Because there's two types of heat pumps. There's like one that kind of just hook up to your house with like air source heat pumps, but then there's bigger ones known as ground source heat pumps, and those can actually take like a whole city block off of fossil fuels. Or district heating systems. So we're looking at developing a slating tool, right? Because there's some communities where that might actually make the most sense for them. Or for really high-rise buildings that maybe have centralized boilers, right? Other ways rather than going into every single room or every single department and putting in system window or something like that. So that's all I have. Thank you.
Thank you very much. So I'm cognizant that I am the one standing between us and lunch, and I want to take a few minutes and just explain how we're trying to tie all of this together in a way that's pretty tangible in Trenton. And then we'll go ahead and have lunch. This is also a plug for a session that's going on at in the second workshop around grading resources and the whole house approach, which we'll talk to as an example. So folks should go to that. But essentially, I'm going to do this very quickly. The whole house strategy that we pursue is incorporating both lead and weatherization strands of funding to reduce lead-based paint hazards, hazard triggers, stress injury fall prevention, radon dust, much of you've heard about, energy efficiency and weatherization, and increasingly electrification and decarbonization, because we work to figure out how to help the state meet their goals. We're currently working on a pilot in Trenton where we're going to be going into 100 units with a number of our partners to basically fix the issues that are preventing houses from being weatherized, so that we can then return them to the Comfort Partners program, who will be working, with our local utilities and with the Bureau of Public Utilities to improve the efficiency of our housing stock over the coming few decades. 2050 is where we're headed. And so we've got a number of different partners at the table helping us do this work. For those who don't know, Comfort Partners is it's a statewide program that's run by local utilities to do weatherization work. One of the major barriers we have in in the weatherization sector is upwards of 50–60% of units, depending on where you're working, sometimes will get deferred from the weatherization program because of a health and safety hazard. So they never even receive the services to get the weatherization. We're working to basically resolve that issue. And while we're in the home, do a comprehensive health and safety assessment, get the lead out, hazard triggers, all of that. But essentially the model we're pursuing is when the unit is deferred, they get sent to us, the GHHI in Trenton. We work with our staff there and our partners to basically work with the client who's been deferred, assess the unit, assess the unit, and do a comprehensive health and safety assessment, which we then use to send crews to the house, get the work done, fix the issues, and any other health and safety issues that might be present in the home, and send it back to Comfort Partners, which then continues with their weatherization process. We have recently designed and are just beginning work planning our implementation with Comfort Partners to take 20 units out of this 100-unit pilot that we're doing to basically start figuring out how to electrify these units in a way that builds both our capacity and Comfort Partners' capacity to basically do this work. So we're partnering it up to collaborate on this stuff. And as we do this work, we're working, and this is an important issue, we're looking not to add any energy costs to the house. We want this to be more affordable. Part of our effort to do that is actually community solar, which makes electricity more affordable. Since we work to pull in all from the solar program, we want to make a lot of long-term and short-term benefits for residents around health, economic stability, while prioritizing households that see health benefits from air quality improvements. We were talking about stoves earlier, and that will be a key piece of this initiative here as well. And then we're going to measure the heck out of this to demonstrate our impact and share it with you all. This is the point I wanted to share is as we've been thinking this through, we have a number of different levels of electrification we're going to be pursuing. So we will fully take houses off of the gas grid and make it fully electrified. For those units, there will be receiving heat pumps, and appliances will be replaced and convert them over, building panel upgrades. In homes where we refer to this as a hybrid heating system, they have a convert gas system to be more efficient. We will go ahead and install heat pumps to get them cooling as we move towards a more efficient future. And in other homes, they require a little bit more work. We will work to get them electrification ready, which is upgrading panels so that we can make future improvements and to accomplish that work. And then all of the homes in the pilot will get standard weatherization as well. So we're working across these different levels as part of the pilot. Again, the learning that comes out of the program here will hopefully be applied to other programs around the state as we work to advance it. I do want to add two great for a TCA light grant that we will be working to bring into this work as well. So a lot of these folks will have electrical out of their homes completely to work we become more healthy and work on primary prevention. I think that's where I will end. Oh, actually, no, this is one important piece of this is through the whole house approach, we are really looking to achieve multiple outcomes around energy, reduced energy, non-energy outcomes around air quality, comfort, health, or energy benefits around lower utility bills, greenhouse gas reduction, helping the state meet goals that we've noted, non-energy benefits, as we refer to them, including occupant health, family economic security, environmental quality, and then long term. I think this is where work is really interesting as we think about it. We were just discussing earlier around that, to highly impacted communities and neighborhoods where we can really try to do this at scale and get to the density in terms of our interventions that we can really start having neighborhood quality improvement and get after sort of place-based health disparities. So that's essentially those are the outcomes that we're looking to achieve. We're measuring the battery of measures that we're hosting or tracking as part of the work on the pilot. And we just wanted to share that with you as we get your wheels turning, your lead programs, for healthy homes programs, to really start thinking about how you layer in these resources that are coming down the pipe and visual aid explained earlier becoming available into your intervention so that you can move towards that whole house. So that's really sort of it and what we wanted you thinking about. I was going to have, and we were hoping to have a little bit of time for Q&A. As I said, I'm cognizant of the fact that I'm standing between you guys and lunch. And so we'll go ahead and do that. I encourage you to attend that afternoon schedule or afternoon session with Catherine and Brandon Castro, who's our whole house coordinator, and try to dive into more details around that. So again, thank you very much. And we'll go ahead and break for lunch. It'll give us 45 minutes to get back on schedule for 1 o'clock. And I just wanted to thank both of our panelists here for sharing that. Lunch. We'll go ahead. Actually, lunch will be straightforward. We're going to open these doors. You're getting a, what do we have, tacos, Captain?
Tacos.
Tacos. And so you'll be able to bring it back in here and eat it.